Okay, so to start for the hip stabilization videos, first we're going to do hip extension. And so for this, you have the patient in prone, just laying down. And so then the hip and the knee are in full extension. And so for this, you would place a stabilizing hand on the pelvis here, posterior pelvis. And then I would ask my patient to raise this leg here, and then I would just apply pressure resisting. So if you could raise this, then you press down. And so if that causes pain, then it indicates tight hamstrings. And if the pain is decreased as the leg is flexed, so if we did the same thing and there's less pain with that, then that's also another giveaway for tight hamstrings. Okay. So for the next one, this is going to be for hip adduction and abduction. So I'll have my patient side lying. So if you want to flip onto your side, face that way.
Oh, face that.
Yeah. Cool. Perfect. And so for this one, both, go ahead and extend both legs fully.
Yeah.
Straight. Oof. And then, you're good. So then the patient will be stabilizing their own pelvis and torso for this. So with both legs fully extended, this is for adduction. I would grab their top leg and then place one leg down here. So it would be the non-tested leg is on top. And then I would have her like push them, pull your legs together. All right. And then obviously you can feel that probably in your hamstrings, quads a little, but then in your glutes too. Okay. And then for adduction, I would then place a hand on the lateral pelvis and then also against your lateral femur here. And then I would ask you to pull your legs apart. There you go.
Ooh.
And then you probably feel that in similar places, also in the glutes. And then did you feel it in your hamstrings, quads?
Oh, I felt it in my knee.
Okay.
But yeah.
Maybe I can put my hand higher up. Okay, try it again. Is that less in your knee?
It's like the inside muscle actually, which is funny. It like kind of shoots down here. That's
your
funny.
Adductors. Okay, so that is it for hip adduction and abduction. All right, so for this last one, it is hip internal and external rotation. And so you have the patient seated with knees flexed over the table. And then the book was saying to have a bolster. I have socks. So I'm gonna use this and like just place it under. I think I'm gonna do two. Sorry, on this same one.
Same.
There you go. Put it down. Sweet. Cool. And then you're gonna stabilize your torso with just hands like down. Yeah. So that's the stabilization. So for this one, can you see the legs? Okay. For external rotation, I'll place one hand here, and then can you see my hand down here? It's like on the lower part of the leg, and then you would turn it to like 45. And then for an internal rotation, place the hand medially, and then try again to turn the hip out of 45. And that's that.